What you're seeing that I'm clicking on is a newly launched tool called ConsultationTool. And this is a really, really neat thing within the software. Because what we're lacking today many times in the chart systems is that we don't have something that is intuitive, meaning also that we can build up and set up the, the treatment of the patient more or less step by step. So what you're seeing here is that we can, for example, we can bring anatomy on and off, we can hide the gums, we can look at the sinuses, the nerves. We can simulate if the patient has a slightly lower smile line or higher smile line. So it becomes more intuitive and it's easier for the patient to understand, because when we're talking, for example, high smile line, what does it mean really? So this is really sort of a tool that brings a lot of satisfaction, because it can be utilized by me as a doctor, but also for my dental assistants to the patient. So for example, if I would take a tooth and say, so we have a tooth here in a patient, and the tooth 4-6, so the first molar on the right hand side in the lower jaw, this is a tooth that we have to extract for any number of reasons. So the first thing that we do is that we have to extract the tooth, obviously. That's a part of the treatment step. And when we do that, depending on if there's an infection, for example, it might mean actually that we lose some bone locally because of the infection. And when the bone is restored, we need to restore that dimension of the bone again. And that might mean that I have to utilize a graft, for example. So I can simulate to the patient here, talking to the patient. So this is the way we add. As you see, we add a little bit of volume. This is important to have the right dimensions in terms of soft and hard tissue for the implant. So at the time that we actually place the implant, we have optimized the situation locally. And when we place the implant, this is how an implant more or less could look like. We place the implant within the bone, away from the nerve. Of course, we have a safety distance. And when we place the implant, we also measure the stability. If it's a molar, we might use a wide implant, for example, because we want to have a nice emergence profile. So we try to have enough width for the restorative part of the treatment. But when we place the implant, we also measure the stability. So if the stability is high enough, that means that we might go with a one-stage protocol, for example, with a healing abutment. It might even mean in certain situations that we might load the case immediately. It all depends on the ISQ value. It tells us an important factor as to the choice of loading protocol and the healing period. Now, when the implant has healed enough, it might be 10, 12 weeks down the road, we have to restore the tooth by means of an abutment and crown. And that's also sort of a step of the treatment. So whatever you prefer as a clinician, you can utilize these different drawing tools, intuitive ways of consulting together with the patient. You can create different scenarios, different perhaps treatment plans. Save these and create exports. So if you're at this stage communicating together with the referring doctor, you can build up different scenarios and different cost estimates, for example. And you can choose what type of steps we need for the patient, how many weeks of healing we need to have between the different aspects. So it becomes much, much easier for the patient to interpret what we are supposed to do with their teeth and tooth. So similar to when we create an export of ISQ data, we can create an export here, for example, of different steps of a treatment. So very, very neat way of, again, of connecting to the patient. So the patient really understands what they're investing in before they actually start the implant treatment.